Welcome back to the Ricky Mathews Show from the Citizens Bank Studio. I really enjoyed that conversation with Brian Haydad. What he and Michael Borky are doing with Sports Talk Mississippi is really, really strong, and you get a sense of that in the conversation with someone like Brian. So that was terrific. So now let's shift gear. We're moving over to Singing River Health Talk, the weekly Wednesday allotment that we have here, where we get to talk about the Singing River Health System and their incredible commitment to the community. And by the way, October is Breast Cancer Awareness Month, so it's a great opportunity for us to really emphasize early detection and proactive breast care for women. I know that my wife and the women in my family are very committed to making sure that they do their annual checkups and to get their screening as the doctors require them to do. And for us, that's going really well. But they've got a great team focused on this, and we get the opportunity today to visit with Dr. John Bailey, who's a general surgeon and a breast specialist, and he has a very interesting background. We're going to kind of boil it all down, and then we're going to talk about why this focus in October is really important to kind of bring back into focus what women need to do to make sure they maintain their health. So without any further ado, let's welcome Dr. Bailey to the Ricky Mathews Show. Dr. Bailey, how are you?
I'm doing great, Ricky, and thank you for having me today.
It's a pleasure to have you. Where are you sitting actually right now?
I am sitting in what we call the Annex office in Ocean Springs. So my main office is at the Pascagoula building. And so those of us who are based there use this when we come over here to see patients.
Yeah, that's terrific. Listen, I have mentioned this to a couple of doctors along the way, but I was, when I graduated from high school, I went to paramedic school at the University of Alabama in Birmingham, and went through the paramedic program there. And then from there went into pre-med. My goal was actually to be an emergency room physician. And along the way, I realized it probably wasn't a good fit for my personality. I got a degree in business and MBA, and kind of the rest is history. But I'll never forget those early days at UAB and, the influence that had on me and what I learned about emergency medicine. I still carry a lot of that with me today. But I know you spent some time in Alabama, in Birmingham, during your early days. Tell me a little bit about where you came from and how did you decide you wanted to get into medicine?
So I grew up in Huntsville, Alabama, and very much enjoyed sciences as I was growing up. Had a few friends whose fathers were physicians, and decided I thought that's what I wanted to do. And then went to undergrad school at Rhodes College in Memphis, then on to UAB for medical school, and then stayed there and did my surgery training for 5 years after that there. And so I finished up in 1996. And then my wife is from Mobile, and she told me we were living on salt water, and voila, here I am. So she commutes to Mobile to work every day, and I work over here in Pascagoula and Ocean Springs.
Yeah, well, listen, incidentally, Huntsville, what an amazing town. I talk about it on my show regularly because when I was working for Advanced Condé Nast, the newspaper there actually reported to me. So I spent a lot of time there learning about what they've done with that arsenal and NASA and the economic growth that has taken place in Huntsville has been absolutely incredible. It shows what can happen when you get everybody on the same page as it relates to that. And I also spent a lot of time in Mobile as well. So I have a great appreciation for a little bit of the path that you took. But UAB, man, what a great place to kind of cut your teeth, isn't it?
It is. It saw everything. It was the biggest referral center in the state. So major traumas from all over the state ended up at our doorstep. Complicated cancer cases, difficult cardiac surgery cases came from all over the world to UAB at that time. And so it was a great place to be young and to train and to learn because of the depth and breadth of everything that we got to see. And lots of good people.
You're a general surgeon that has, kind of a good wide range of experience. At what time, what point in your career did you realize that there may be a specialty for you in the cancer realm as it relates to women's health?
Probably about 20 years ago, I started thinking about this. And when I was a resident and finished, there were very few breast surgery fellowships in the country. It was just starting to take off. At the time, surgical oncology was the route that people went, which was a more academic-oriented sort of fellowship than breast surgery fellowship today, which sends most of the doctors out into private practice. But so during that 10-year window between I finished and I got this idea, that started to really take off. And I thought that I would like to learn more about the breast surgery side of things. It was evolving a lot at that time, going from doing complete axillary node removal on patients to removing just a few nodes to get the same quality information that we needed with less wear and tear on the patient. And so I evolved into that. And over about 5 to 10 years, my practice continued to evolve here locally, where I was doing the bulk of the breast surgery in our group of surgeons, which has ranged from about 5 to 8 surgeons, depending on the time in the year. Currently, we're 6 in our group. And I'm doing far and away the bulk of the breast surgery done in the Singing River system in Jackson County at this point.
Yeah, it's an interesting thing. What I've noticed in just about every conversation I have, and I've been having these conversations with doctors and professionals for Singing River for quite some time now. And one of the things that really sticks out to me is that if you think about technology advancements and procedural advancements and all of this, there's a big awareness these days on minimally invasive procedures, just doing everything you can do to make recovery better, to give people a better chance at living a normal life in the future. But when you think about breast surgery, there's been a lot of advancements there, hasn't there?
There has. It's the surgery itself hasn't changed significantly over the last 2 or 3 decades, as far as the breast itself is concerned. But the lymph node retrieval, the lymph node biopsies have changed dramatically. We do far less surgery in that area than we used to, and we're going to do even less in the decades to come, and it may be sooner than that. The percutaneous biopsies that we do using ultrasound guidance and mammogram guidance were very new when I finished residency. So we're talking just 30 years ago. And so that's the norm nowadays and has been for quite a few years. And so we're able to do biopsies on many of the patients here in the office on the day of their first visit. So within a day or two of seeing me, we often know what the problem is and where we're going next. The other big advance has been the multidisciplinary aspect of this, and that there's better radiation treatments for the patients that need that. There's much better chemotherapy, more successful chemotherapy than we had 30 years ago. The radiologists have much better mammogram machines, better ultrasound machines. MRI of the breast didn't exist 30 years ago. So we're advancing on all fronts, and again, because it's a team approach.
Yeah, one of the, I've said this often, and for regular listeners, they probably get tired of me saying it, but I think it's extremely important. The way you're able to retain physicians like you and others who are working very hard to be on the cutting edge, you've got to continue to make significant investments in technology. And one of the things that hits me is when I have had the opportunity to visit with radiation oncologists, what has happened in that space has been unbelievable, where they've had the precision they're able to use today versus where they were even 5 years ago. It's unbelievable, the advancements there, isn't it?
It truly is. And, those things that you're talking about where they can focus on that one little spot are often that point of pain for those patients when they have a cancer diagnosis, and they can treat that in often just a few days and make the pain go away and kill the cancer. And it is incredible what they are able to do.
It really, one of the interesting things that I remember him saying, that if you think about a spot in the body, a very small spot in the body where you want to direct that radiation therapy, that as even though the person's laying there still, that spot could still move just because it's inside someone, and the body is not a still object, but it's able to follow that spot. Once you direct it, it's able to follow that spot. And as a result of that, you're able to kind of, really, really reduce the amount of radiation, I guess, injury, or however you want to say it, that results from the way it used to be done. It's just it's all focused on outcomes, to improve outcomes, to make it so that people can get their treatment and be able to move forward in a way that gives them as best an opportunity to have a normal life as possible. And I think that drives you guys in everything you do, doesn't it?
It does. And, our goal is cure. If we can't cure, our goal is better, and better is less pain, better quality of life. make the time that you have left here better. And we are able to treat many of the patients who have metastatic disease for years, and they do well.
Yeah. Yeah. Hey, listen, when we come back on the other side, we'll end the show with some of the most important parts. We'll talk about early detection and screening and make sure that people really understand why we need to focus on that. But I want you to mention real quick, if you don't mind, you talked about the team approach, but it really is a team approach. As you go to a patient and start to determine what's the path we're going to get to the best outcomes we can possibly get, you got a lot of people involved in that discussion, don't you?
We do. And it is a daily conversation, mostly for me, with the doctors at the cancer center, medical oncologists that do the chemotherapy and the endocrine therapy, the radiation oncologists that do the radiation you were speaking of earlier. But then, there's also the radiologist who's reading the films, the pathologist who's telling me what our biopsies are showing, giving me the data that tells us, does this patient need to do this now or do something later?
Hey, why don't we do this? We're coming to the end of the segment. If there's anything else to mention, because I think there is, as it relates to that team that works closely with you, we'll say it on the other side, and then we'll remind everyone why early detection and screening is so important. When we come back, we'll continue our conversation with Dr. Bailey. Welcome back to Singing River Health Talk and the Ricky Mathews Show from the Citizens Bank Studio. We're visiting with Dr. John Bailey, who's a general surgeon. He's actually a breast specialist, and so in the first part of the show, we zeroed in on how he developed that. He's board certified in so many different ways, and he's really developed a very specific specialty as it relates to breast cancer surgery. And, as I mentioned at the beginning of the show, October is Breast Cancer Awareness Month. And so we're really going to be focusing in this segment on detection and proactive breast health. But look, before we go any further, I just want to let you finish that conversation about the team that's around you to make sure that women are making the best possible choices and have the best possible outcomes. Is there anything else you wanted to say about that?
Certainly. It allows, the patients to have access to all the specialists that are involved in breast cancer care. And again, it's not just breast cancer care, but it's also detection of suspicious areas or doing mammography to say, you look great, don't come back for another year because you're doing fine. And, that's the beauty of it, is that we all are focused on getting the best care we can for those patients. And so when I say that I need somebody else to give you an opinion on this to a patient, that's because I think they have a better source of input than I do in this particular scenario.
Yeah, that's great. So you're involved in breast conserving surgery, mastectomy, coordinated reconstructive care. There's a lot of angles as it relates to your specialty, and you got a team to work with as it relates to that. So as you think about, the issue of early detection and doing the kind of things that women ought to be focused on to be on top of, just, give your speech that you typically would give to women about why it's important to stay on top of these things.
So, I still recommend that women do monthly self-exam. It doesn't find a lot of cancers, but it does find some. I recommend annual mammography starting at age 40 for the average patient, average risk patient, that is, which again is 1 in 8 women in this country. So it's an enormous number of women that are going to develop breast cancer. Some patients need to start those screenings at an earlier age based on their family history. And we try to coordinate that with those folks as we see them. And then the women who are at increased risk of developing breast cancer, based on their calculations, their family history, their genetic testing that we do, we recommend often that they get screened at least twice a year, alternating mammography and breast MRI to try and catch anything that might happen at an earlier date. Some women who have higher risk opt to have their breast removed as a risk reduction procedure before they ever develop cancer. And certainly, we take care of those patients. We talk with them about the risk, the benefits of those things. And then we coordinate with plastic surgery if they decide they want reconstructive surgery after that as well.
Yeah, I have an in-law who did that, and she had a really good outcome. And it had to do with a really unfortunate family history related to it, and she just wasn't going to take the chance. And I think she made a great decision, and her outcome is great. 3D mammography is, it's in some ways, it's kind of a game changer. It gives you such a beautiful view of what you're looking for, doesn't it?
It does. It is much easier for us to detect smaller abnormalities at an earlier stage. And, it's quicker for the patients for the most part, too, as far as we eliminate a lot of the callbacks because we didn't see something real well on the 2D views that we used to do. So now we see it better in the first set, and they don't have to come back and spend another day getting more films.
So let's see, includes an enhanced breast cancer risk assessments from Volpari for $129 with no insurance required. Is that a nice added attraction to this information?
It is. This is always a busy month for the radiology folks here at Singing River because of those specials that they have. And a lot of times it bleeds over into November because they just can't get everybody in. And the hospital's been kind enough to extend that, in years past. But yes, there is a wealth of benefit from that.
A lot of people. Yeah. Sorry, Dr. Bailey, make your point again. I'm sorry, I didn't mean to step on you.
Unfortunately, cost goes up a little bit every year, but the technology cost has gone up for the system. And so, everything creeps up a bit, as you know.
Yeah, that's unfortunately the reality of that situation. Breast Cancer Awareness Month is a really good opportunity for people to focus in. So people who are listening to this show now, I would say it's a perfect time for you to schedule a mammogram and encourage your loved ones to do it too. It's unfortunate, many of the doctors have been on the show who have talked about cancers. It's so unfortunate when you find a patient who's not been proactive, and by the time you see them, it's a situation that is much worse than it otherwise would have been if they'd have been doing their annual stuff the way it needs to be done. And that gives you a good clarion call for why you want to communicate, especially during Breast Cancer Awareness Month, about why women need to be way more proactive. Kind of make your pitch about that.
Certainly. It is the best chance that we have to get rid of the cancer, to cure the cancer. The earlier it's detected, the better we all are at treating it. And it's, hard on the patient. It's hard on their families, as you discussed earlier about your family member. It is difficult for everybody when somebody has a cancer diagnosis. And so obviously it's to the benefit of all, including us as physicians, to bring them in early, get this thing figured out as quick as we can, and get them on the road to being cured of this problem.
Well, Dr. John Bailey, general surgeon and breast specialist, here on October being the Breast Cancer Awareness Month. I really appreciate you spending some time with us. This has been terrific, and keep up the great work. And your passion for what you do really does show, and I appreciate that. Take care, my friend.
Yes, sir. Thank you.
You bet. You bet. And listen, this has been Singing River Health Talk. Listen, have a great day, and we'll see you tomorrow.